Greetings from Arogyam Katta. Today, we have with us Dr. Shreyas Padgaonkar, a renowned infertility specialist with over 25 years of experience. A pioneer in IVF, he has helped countless couples achieve their dream of parenthood. Dr. Padgaonkar holds a postgraduate degree in gynecology and a fellowship in reproductive medicine from Royal Medical College, Melbourne. He has set up more than 14 IVF centers in India and abroad and has written several articles and addressed numerous conferences. Let us welcome Dr. Shreyas Padgaonkar.
Welcome to 6th episode of Arogyam Katta. Today we have with us Dr. Shreyas Padgaonkar, an IVF specialist. To his credit, he has experience of setting up more than 30 IVF labs across India. So, welcome Dr. Shreyas Padgaonkar to
Thank you for having me
IVF
in your program.
Arogyam Katta.
Very happy to participate at Arogyam Katta.
Thank you. Can you explain what is IVF? We hear this word IVF, but doesn't know what exactly is the process and what is IVF.
IVF, the full form of IVF is in vitro fertilization. It means the process of fertilization, that is combining or coming together of the egg and the sperm, happens outside the body or in vitreous. In Latin, vitreous means glass. So any fertilization process which happens outside the body in laboratory is called IVF. In common language, it is called as test tube baby.
Okay.
And you ask how this process happens.
Correct. What is IVF?
Essentially, this process was designed to overcome obstacles for many women who have problems getting pregnant, where the process of fertilization does not happen, or there is a problem of transporting the eggs and the sperms in the body. So, the concept is to remove the egg out of the woman's body, combine with her husband's sperms, create an embryo, and as these embryos grow, choose one of the best embryos that we have and put these embryos back into the uterus.
When you say choose one of the best one, how do you know which is the best one?
As of date, we are not absolutely perfect in choosing embryos, but there are certain parameters which we observe in the laboratory. Basically, how the embryo grows, how many cells it has, at what time interval all these events happen. So we have a timeline which runs, and we see which embryos are conforming to timeline and how the embryos look, what is the structure, what are the imperfections that we see under the microscope. And there are these criteria from which we decide which embryos will have a better chance of becoming a child. But it is not an absolute and foolproof process even today after almost 40 years of usage in the in this world.
Typically, what is the length of this cycle, what you are talking? How many days it takes, or what is the time, you said timeline. So what is the timeline of IVF?
Okay, the timeline inside the laboratory starts when the eggs are recovered in the body. And that day is, in our language, is called as day 0. From the day when the eggs are retrieved from the woman. And the next day, we check whether the sperms have fertilized this egg. And the day after is actually when we start seeing the growing cells in the embryo. So on day 2, that's around 48 hours after the recovery of the egg, we should have around 4 cells. On the 3rd day, that is 72 hours afterwards, we have around 8 to 10 cells. And 2 days later, that is day 5, we have a structure, what is called as blastocyst, which is a more advanced stage of the embryos. So this is how the timeline moves, and embryos are transferred back into the uterus anytime on day 2, 3 or 5. That's the normal standard way. Even today, we cannot support the growth of the embryos beyond day 5.
Okay.
Externally, we have to put it back.
So it has to go back to the womb.
Yes.
How is it put, surgically?
In the process of IVF, the only so-called surgical procedure is retrieval of the eggs outside the body. but it is not done with the conventional form of surgery that everybody thinks that it's going to involve an operation, it's going to involve a cut, it will involve a stitch. No. It is done internally using a tiny needle which is put inside the ovary where the eggs are going, and a delicate suction sucks these eggs out into a tube, and then they are recovered. So that's the only surgical so-called part of it. Whereas putting the embryo back into the uterus is a painless procedure. It's done with an extremely thin, soft plastic tube, barely millimeter or two in thickness, and it's painless. So you don't need any anesthesia.
No anesthesia, nothing.
Anesthesia is given for the first procedure where the eggs are retrieved, because some women may find it troublesome, painful.
Okay.
And that's also a very light form of anesthesia. So generally anesthesia is very light, and embryo transfer is painless without any anesthesia.
You must be dealing every day with patients. What are the common myths or misconceptions about IVF? Or what are their fears, I would say, about
so
IVF?
The commonest misconception of IVF, even today in our community in country, is many people think when you do IVF, you are using somebody else's eggs and sperms. And that's not really true. It's done only when the couple doesn't have one of these. As a routine, the husband and wife's eggs and the sperms are used. That's the first misconception. Second misconception is IVF causes a lot of side effects in the body. IVF makes you fat. That's not really very true. The drugs used in IVF are really very safe. I would say one of the safest in medical practices. There are multiple reasons for that. One of the reasons is these are what we call reproductive hormones. Now, there's again a misconception in the society that hormones are bad and they act everywhere. No. These hormones are like lock and key. They will act only on specific cells in your body, which are the egg cells in the body. These hormones have no function, no possibility of having any effect in any other tissue of the body. So inherently they are safe. Number two, they are either made from human urine, so it's a naturally produced product, or they are made by genetically engineered bacteria, which is very similar to how insulin is made today. So it's very natural product, it cannot be chemically synthesized, so as to say. And number three is they don't stay in the body for more than 24 hours. And that is why they need to be given every day. So all this inherently makes these drugs extremely safe as compared to many other pharmacological agents today. Another misconception is IVF children have abnormalities. And this has come from some reports way back which would report IVF has an abnormality rate of 4%. But what people don't understand is it's against a background rate of around 2 to 3%. And most importantly, the abnormalities basically depend on the woman's age. And women who are doing IVF are obviously far older than the normal population, people who are getting pregnant on their own. So automatically you have a bias towards elder women entering this school for studies. And this is how distorts the picture slightly. But over almost now 4 decades, IVF has proved itself that these children don't seem to have a higher risk of any major abnormalities as of date.
So does it mean that one should conceive or one should have a child in younger age?
Of course, the younger the better, because that's how nature has designed everything. And we know that the incidence of everything, like the chance of you getting pregnant starts falling as you grow older. Chances of abortions start rising. Chances of abnormality starts rising as the age increases. So theoretically, yes, you should get pregnant as soon as you can, depending on what you wish in your life.
Any lifestyle changes that a couple has to undergo?
Yes, of course. One of the biggest lifestyle challenges that now I face in my practice, vis-a-vis what I used to see when I started around 30 years back, is the big problem of obesity or high body weights.
Okay.
And that has quite a negative impact on success and the outcome of treatments as well as outcome of pregnancies. Because if your body weight is much higher than ideal when you try getting pregnant, your success is lower. A higher body weight women have a higher risk of abortion. They have a higher risk of developing blood pressure, diabetes during pregnancy, which puts the child at risk. So weight management or weight reduction is going to be very important. Other lifestyle changes that are absolutely important is, or absolutely detrimental lifestyle choices people make is smoking and use of tobacco and other recreational drugs has a very negative impact on the quality of the eggs, especially for the women. And of course, smoking and use of tobacco in any format is very bad for the sperm health also. So these are the two major issues that we face in practice.
What is the success rate?
Okay. Before we talk about the success rate of IVF, it's extremely important to understand what is the success rate of humans as a species naturally. You must understand that the most fertile couples on this planet will have a success of barely around 20% a month. So humans inherently are far less successful in reproduction as compared to, say, cows or buffaloes or other animals. So we need to understand the success of all the procedures in the context of what is possible or what is given to us by nature. Expecting absolutely fantastic success rate at IVF is very unrealistic. It's as good as somebody wishes that he's going to run faster than a horse by practicing running every day for the next few months. So understand that in the best situations, around 20% is the chance of an egg or embryo becoming a child. And today I think we are kind of in that range with the advances that have taken place over some time. Again, the success at IVF, if you just talk of success, it's basically governed by how many embryos are put back into the uterus. If you put 3, 4, 5 embryos back, you will get maybe 60%, 70% success. But this success is going to come at a price for some couples because they are going to have triplets and quadruplets. So if we restrict the number of embryos that we put back into a safe zone of, say, maybe 1 or sometimes 2, realistically you cannot expect success more than, say, around 40%. And which is what today the best centers in the world would report when it's reported truthfully.
If suppose first cycle is unsuccessful, you can do multiple cycles or either after first cycle, the end of...
In most instances, yes. The first cycle is one of the most important cycles because it gives you a first-hand information about a lot of issues which we cannot test. We cannot do a test to check if the egg health is good or not, if the embryo formation is happening properly, if the embryo growth is happening properly. When the first IVF happens, the laboratory can then report on the quality of embryos, how many embryos were created, and based on this, we can then counsel the couple whether to go ahead and try a few more cycles. But if you look at the general statistics, it is said that up to first 4 attempts, the success seems to be very steady. What it basically means is people who have almost no chance of success will be unsuccessful by 4th attempt. So almost everybody should get pregnant by then.
Or give that effort.
Yes, it's true.
What's the typical cost of, I know it would change from center to center, but typically if I say average cost per cycle.
The cost of IVF is basically governed a lot by the cost of the drugs, which is the most expensive part of the treatment. And as you know, the drug cost can vary depending on the manufacturer and brand and all of these things. But if you take an overall picture, IVFs can cost anywhere upwards of 1.5 lakhs when you include all the medication. You can, if you exclude, then the costs are going to be much lower than this number. But anywhere
becomes one of the major.
Yes. So
are there generic medicines available?
No, all the medications are branded, but basically different brands have different pricing. So
But the government of India is...
No, I have not come across any generic
medications.
I haven't come across.
Are there, 40 years back and today IVF, is there any change or is the same old story continues?
No, it has been a huge difference in the last 40 years. And when I started training in IVF around 30 odd years back, putting 3 embryos was the norm. Why? Because our success was poor. The number of embryos which would grow to a more advanced stage was much less. With the more advancement of technology, having better equipment, better culture media in which the embryos grow, all the successes have grown to an extent that today a lot of couples we can with confidence say that you should take maybe 1 embryo and maybe freeze the rest so that we can try at later point. Whereas previously we would transfer 2-3 embryos. Say for our last almost 20 years in my practice, I haven't transferred anything more than 2 embryos. So effectively, we made sure that nobody in my practice would get triplets. And that's very important. Because triplet is always a very bad situation for the babies. Big changes have come into a technique of embryo freezing, or vitrification. Before vitrification, the previous technology was not very good in survival of the frozen embryo. But vitrification changed it so much that we expect survivals of upwards of 90% in most labs. So we can freeze these embryos with confidence, so we can put less embryos back with confidence because we know that we have them as a backup. So much so that a lot of patients today with us, many of them would finish their entire family in one attempt. They may get pregnant right away, they will have some embryos frozen, and they come back after 4 years, 5 years and take the frozen embryos back and have another child. All of the technology
evolved.
Yes, and a lot of other technologies are evolving, especially geared towards the safety of the procedures. But that's quite a big discussion.
As AI, artificial intelligence, entered into IVF too?
People are trying. Again, to be very frank, when we talk about something like AI, basically we are talking about a process which has a lot of data points to analyze. And the only way or only place where all this thing is possible and feasible in future is evaluation of the embryos, which happens in the lab. There have been attempts to automate this process of identifying a good embryo over the last 2 decades by using different software analyzing captured images. Unfortunately, not a single algorithm has proved very effective. And that's where people are talking about using AI to analyze it further. So this is where maybe AI could have a role.
What's your advice to couples wanting to undergo IVF?
I think they must, if their physician has advised them IVF, they should do it as soon as possible. Every month that you waste or every 6 months you waste, your success goes down.
Chances.
Because especially a huge problem that we see in today's practice, just as compared to what I would say 10 years back, is women coming to treatment at a little older ages, after finishing careers or settling down, and understand that the number of eggs in the woman's body keeps on decreasing every month. Every month, and it's an irreversible process. And somebody may lose a chance of becoming a mother altogether if sometimes you just postpone your treatment by 6 months or 1 year. And be rest assured that the treatments are not difficult, they're not painful. You don't need to leave your job for treatment. The treatment should be able to fit, a good clinic should be able to fit treatment inside your daily routine. They don't make you sick. And you don't need to take bed rest after the embryo transfer. That's a big misconception, and people worry about it because they can't afford to quit the job. So I would recommend that you should go to IVF with confidence and as soon as possible if you have been advised to do so.
Thank you, doctor, for giving an insight of IVF. We'll have quick rapid fire round questions, but I'm really thankful that you came to Arogyam Katta and benefited our this thing and cleared doubts. Thank you very much. Doctor, I'll ask you a few rapid questions, answer of which can be in yes or no. IVF treatment is very expensive.
Not really.
IVF increases the chance of having twins or triplets.
Twins maybe yes, triplets in our practice is 0. Depends on how many embryos go back.
IVF guarantees a successful pregnancy.
No, but most people will achieve pregnancy if they try enough.
It is possible for a woman of any age to conceive through IVF.
Yes, provided she has eggs of good quality or she uses donor eggs if she has none.
IVF leads to birth defects.
No, IVF children have very similar incidence of birth defect as a naturally born child.
IVF treatment can be done multiple times if first attempt fails.
Yes, it can be.
If the first pregnancy is through IVF, is it necessary that subsequent pregnancies are through IVF only?
Depends on what the reason for the treatment was. But in most instances, the problems are such that they don't get rectified on their own and they will need IVF again.
IVF is against religious beliefs.
I really don't think I have not come across such things in my practice as of yet. And I can't really comment on many other religions.
Is it possible to freeze and store embryos for future use in IVF?
Yes, very much. Embryo freezing is a routine today.
Thank you for answering the questions.
Thank you.
Thank you, doctor, for coming.
If you have liked the video, please subscribe our YouTube channel and press bell icon. Thanks for watching.